Hi, I'm Jasper from Milton and Fornham Chiropractic Clinics, and today I'd like to discuss a tennis elbow with you. We're going to discuss the symptoms, the common causes, tests, exercise and therapy, and some supplements you can take as well to help you getting over a tennis elbow. Stick around because two of the exercises I'm going to show you are eccentric exercises, and I've not seen them anywhere on YouTube, and they're really effective when you're dealing with a tendon injury. So stick around for that as well, and that will come later on this video. So a tennis elbow essentially is a pain located around the outside of your elbow. It's very common. It's thought that one in 3 people will suffer from a tennis elbow at any given time. So you're not alone if you're struggling with it. You see pain arising when you're lifting something, when you're bending the arm, when you want to grip small objects like a pen, when you want to open a door. Opening a jar can give you the pain as well. And unfortunately, even pouring a cup of tea or coffee can give you the pain on the outside of the elbow. Now, it is called a tennis elbow, but actually only 5% of tennis elbows are caused by some form of racket sports. The vast majority is caused by some sort of repetitive overuse injury. So you're talking about, for example, bricklaying or plumbing. Painting, decorating can cause a pain, but also working in front of a computer and using a computer mouse the whole time. That can also give you a tennis elbow, so the pain around there. Or using shears when gardening. It's all this repetitive movement, smaller movements that can give you the pain. Now, if you want to know if you are suffering from a tennis elbow, there's a test you can do. It's called the Maudsley's test, in case you're interested. You never know. What you do is you straighten the elbow, straighten the wrist, straighten the fingers. Keep it all straight, and all you do with the other hand is you push down on your 3rd digit on your middle finger. You resist the pressure, and if this gives you the pain in the elbow or the forearm, you have what we call a positive test. As in, yes, it reduces the pain, you've got a tennis elbow. So, the therapy. First thing you should be doing, a little bit boring, can't help it, but you have to avoid activities that cause the pain. You have got an injury, give it time, give it the opportunity to heal. So if you can reduce activity that's causing the pain or avoid it altogether, it will help you in the long run. The second thing is a stretch, which you can do. Simple stretch. It looks a little bit like the test that we've done before. So you straighten the elbow, straighten the wrist, hand palm facing down, then you turn your palm facing outwards, so away from you. You bend your wrist, and then with the other hand, you come on top and you push the wrist a little bit down. Now, you should feel the stretch in your forearm, around the tennis elbow, and the forearm here. Yeah, and then what you do is you hold this for about 10 seconds, and you repeat this about 3 times, and do it 3 times a day. So that's a great stretch to stretch out this tendon and the muscle that causes the tennis elbow. Now we come to the exercises I've mentioned. It's called eccentric strengthening, is what you want to do. Very effective for tendon injuries, in this case the tennis elbow. So the way to do it is like this. So this is the first eccentric exercise I'd like to share with you, which is very, very efficient when you're dealing with a tennis elbow. And what you need is one of these elastic bands. It's called a TheraBand, and I've tied it up to the door handle, as you can see. So the way to do this is this. Make sure there's no tension on the elastic band to start off with. Face the door, straighten the elbow, but now move your wrist up as far as you can. Yeah? Hold this tension, take a big step back. Taking a step back now, and keep your elbow straight and slowly move your wrist down until you're in neutral. Then you step forward again, as in take the tension off the band again. Move your wrist up again as high as you can, as far as you can. Take a step back again, and slowly drop that wrist until neutral. Yeah, last one. So again, forward, keeping the elbow straight at all times. No tension on the band. Wrist up, step back, and slowly drop that down. So that's the eccentric exercise. The first one I'd like to share with you. Very effective for tendon injuries, like a tennis elbow that is a tendon injury. So repetitions and sets. I'd like you to do 10 repetitions, do 3 sets to start off with. If that comes easy to you, then up your sets. So keep your repetitions the same as in 10 times, but sets do like 4 or 5 sets of this exercise. So this is the second eccentric exercise I like to demonstrate to you for a tennis elbow. Very, very effective. Similar to the one you've had before. What you need is a table with an edge. You can put your wrist down from, some sort of weight. You can use a dumbbell, or in my case I've just used some fluid. You can use a pint of milk. I mean, there's all sorts of stuff you can use as weight. And what you do is you first of all keep your elbow straight and move your wrist as far back as you possibly can. And all you do now is very slowly drop this weight down. Now the next thing is important. Do not use the same arm, the affected arm, to pull the weight back up again. That's what you want to avoid. You want to use the other hand to get your weight back up again, and again slowly drop that down, yeah? And again up and slowly drop that down. And the same thing, you do 10 repetitions, you do about 3 sets. If it comes easy to you, either you increase the weight or you increase your sets. So you keep it on 10 and you do 4 or 5 sets, but increasing the weight is also a possibility. So this is the second exercise, eccentric exercise, very effective for tennis elbow. So there are a few more things you can do if you want to treat your own tennis elbow, and they're all very, very effective again in reducing the pain. The first thing I'd like to share with you is called ice therapy. Super simple. All you need is an ice cube and some form of towel or a cloth or whatever you want to do. So hold it in the other hand, protect your fingers by using the cloth and the ice cube in this hand. And then all you do is you go over the painful area and in a circular motion for about 5 minutes. Super effective, low key, and really helps. 5 minutes every day, or you can do it even several times a day actually. I mean, there's no limit to this, and it really reduces the pain in the elbow. So ice therapy, a good one. The second thing you can do yourself is what we call cross friction. Now for cross friction, you need a pillow. So put your affected arm on the pillow, and so the tendon runs from that bony bit just outside the elbow where the pain is to the wrist. And the idea of cross friction is you're breaking down adhesions, a little bit of scar tissue that has formed over time around the tendon. So you find the tendon bit, you put your middle finger on top of your index finger, so you're supporting your index finger, yeah? And all you do is you apply pressure across the tendon. So again, the tendon runs from the elbow to the wrist, so you go across it. You apply pressure from top to bottom, and you release the pressure when you come back up again. So you put pressure top to bottom and release the pressure again, pressure top to bottom and release it again. Definitely going to be sore initially, no question about it, 1-2 minutes, but apply this for about 5 minutes, again, several times a day, and that's very effective as well, helping you getting rid of your tennis elbow. The third thing you can use is the strap, the tennis elbow strap. Very, very good thing to use as well. Now often they should come with some sort of cushioning here, and the idea of a strap is that you place the cushion on the belly of the muscle, and that relieves the pressure on the tendon. Now where do you find the belly? The belly of the muscle is here. Find that very tendon area first. That's where your tendon is. Then you put a thumb on it, or you go down, and then where the thumb ends is where the muscle belly begins. Yeah, so strap on. So my tendon is here, or my bony prominence is there, so I put my thumb underneath it, my thumb ends here. That's where I'm going to put my, there we are, the strap there, and I want it fairly tight to push the muscle belly down, and it relieves the pressure on the tendon. So that's what you want to do there. Not too tight, you don't want to cut off over your blood supply, but fairly tight, and you can leave this on all day long, absolutely fine, no problem at all. The next thing I'd like to talk to you about is an ergonomic mouse. Very, very effective as well. So if your work involves a lot of computing and using your mouse a lot, then it's worth getting yourself an ergonomic mouse. Reason being, if we look at the resting position of a hand, normally, it's almost like a little bit of an angle. This is a relaxed position. Now with a normal mouse, what I have to do to control it is I have to turn my hand and my wrist a little bit further to get my index finger over the button. So this turning and rotating puts additional pressure on the muscle in the forearm, which can lead to a tennis elbow. Now if you look at an ergonomic mouse, like the one that I have here, is this almost slots in perfectly with the natural relaxed position of my hand anyway, and therefore this is a lot better. I don't have to twist my forearm too far, it sits naturally, I can use the buttons in a natural manner, and I put less pressure on the elbow, which helps to prevent a tennis elbow. So the last bit of therapy I'd like to share with you before we move on to the supplements is Shockwave Therapy. Very efficient indeed, especially if you combine it with the eccentric exercises I mentioned before in this video. Shockwave therapy works by breaking down the adhesions to the scar tissue that forms around the tendon and causing you the pain. So it breaks that down and it increases the blood supply to the tendon. Now when you look at the research, 7 to 9 treatments should on average reduce the pain by around 70%. So it is super effective and definitely a tool that you should consider if you are suffering from a tennis elbow. You also should use some supplements as well to reduce the inflammation. You have got a pain, you've got some inflammation in the elbow. Now there are loads of supplements out there. The 3 ones that are best researched and have got really strong scientific backing at this moment are omega-3 fish oils. So please use them to reduce the inflammation in your body. The second one that's only come out recently, about 2-3 years, is curcumin, which is the active ingredient of turmeric. So you take that one as well in pill form. And the last one, that is especially effective in the older patients, is zinc. So you're talking about fish oil, curcumin and zinc. And they're very effective for reducing inflammation and aiding and helping recovery when you're struggling from struggling with a tennis elbow. I hope you found this useful. If you have any comments, please leave them in the box down below. Good luck with that and bye for now. Bye bye.